Greetings. Let us learn about acute pancreatitis. We have learned about the location of the pancreas, and here is a normal pancreas, and the pancreas has gland structure in the form of lobules, and the glands secrete pancreatic juice that is collected by the pancreatic duct, and the ducts drain into the duodenum. Two common causes for pancreatitis. One, gallstones, and number two, alcohol. In addition, pancreatitis could develop from a number of different causes, but the most important things to keep in mind, gallstones and alcohol. As you can see, the lobular architecture, when there is inflammation related to an attack of pancreatitis, the lobular architecture of the pancreas gets obliterated. And in this case, there is interstitial pancreatitis, that is swelling and inflammation of the pancreas that obliterates the lobular architecture of the pancreas, and there may be a little bit of inflammation surrounding the pancreas with fluid collection. On the other hand, if the inflammation is severe and there is necrosis or severe damage to the gland, it results in what is called necrotizing pancreatitis. In this case, there is much more severe damage to the pancreas, and the duct could be disrupted with the leakage of pancreatic juice into the surrounding structure and the fat necrosis. In severe necrotizing pancreatitis, it results in loss of fluid. It's almost similar to the amount of fluid that one loses with a third-degree burn. In this case, it is a third-degree burn of the retroperitoneal tissue with a lot of fluid extravasation, as well as inflammatory markers causing damage to the systemic circulation, lungs, and kidneys, with resultant cardiovascular failure, respiratory failure, kidney failure, etc. When there is severe necrosis, that gland is at risk for infection, and here is necrotizing pancreatitis with infection, which is much more severe and needs a prompt treatment. Another condition that one needs to keep in mind is autoimmune pancreatitis, where the whole pancreas turns into a big sausage, swollen pancreas from head to tail. So let us learn about the clinical presentation of pancreatitis. Here is a patient who comes in with severe epigastric pain with radiation to the back, nausea, profuse vomitings, and because of that, they've lost a lot of fluid. They may have tachycardia, and these patients, if the attack is mild, their oxygenation is normal and the blood pressure could be normal. And when you do a blood test, they will have elevated serum amylase and lipase. And when you do a CT, the CT shows a swollen pancreas with intact vasculature. They will enhance when you give a dye. And this is mild pancreatitis. So let us learn about what happens when the pancreatitis becomes severe. Again, patients present with severe epigastric pain, nausea and vomitings, tachycardia, tachypnea, hypotension, and on blood tests, the amylase and lipase will be elevated, and the CT scan shows swollen pancreas with inflammation and necrosis. And these patients tend to do poorly. They may be in the hospital for several days to weeks, and this is something that requires intensive management. This is a case of severe pancreatitis. I hope this is useful. Thank you.